Hi, I am Dr. Elizabeth Yurth, and I am the founder and chief medical officer of Boulder Longevity Institute in Boulder, Colorado. And I am here with one of my best friends, best colleagues, partners in crime, Dr. Cynthia Keller, who tell us about a little bit about yourself.
Thanks. So I'm a pediatrician who also does integrative and longevity medicine, really cellular medicine, which is what we're going to talk about. And I have a wellness clinic in the Seattle region.
And so one of the things we always say is we actually don't do functional
Right.
medicine. Like that's sort of everybody advertises themselves as longevity doctors doing functional medicine, whatever it might be.
Right.
And we practice a little bit different kind of medicine called cellular medicine.
Right.
Right? And I think that people have no idea what that means.
I think you're right.
Like, so when we say, oh, actually, we do a kind of different medicine, we do cellular medicine. So that's one of the things you and I wanted to talk about today, was kind of picking out what is cellular medicine and why is it different from maybe how most doctors look at disease states or even wellness states.
Right.
So tell me your thoughts on
Yeah. So I think, sort of traditional or conventional medicine, right, maybe doesn't do a very good job of looking at root cause. And then functional medicine, I would say one of their gifts, right, is that they think about organ systems and how things relate to each other and root cause for that. And that was really great when that was sort of new to us, right, after coming out of conventional medicine. What cellular medicine is that we actually understand the cell and the reactions in it and the pathways that occur in the cell, both in health and in disease, so that way, when things tip or go wrong and disease happens, we actually know exactly pinpointed, or we can figure out anyway, pinpointed where the pathways went wrong. And then this is the important part, right, is that we can figure out how to change that because we also understand how things interact with function of the cell.
Right. And health overall, right?
Right.
Including aging.
Right,
That
exactly.
function of the cells at the root of every disease, including aging.
Right.
And so I put this slide up sometimes when I say we can fix any disease as long as we know this. And I have this complex, looks like the subway system in New York.
Oh, yeah,
of
yeah.
all the metabolic pathways. And you're like, if you know all this, you can fix any disease.
Good.
But really, it kind of comes down to, honestly, there's really about 10 different pathways. We're not going to go into them, but between AMPK and HIF1 and FOXO, there's kind of 10 different pathways that if you actually get a really good handle on, you can actually kind of address most diseases. So we sort of narrow down most diseases, including aging, into one of these 10 pathways, or a couple of them. It's not usually one pathway that's affected. Then we can actually intervene. And, it's really where things like peptides have their power, right?
Right, exactly.
Is that peptides can really insert themselves into these different metabolic pathways and act as signaling molecules to change that pathway and ultimately change the state of disease. It's a harder medicine, right? Because you and I never thought we'd have to go back and learn every metabolic pathway. In fact, when I was in medical school, and you too, you're a little bit younger than me, but we didn't even know that these pathways existed a lot, right?
Right, and when we did, I thought I had to learn them once, study them, I could take the test, and then I was just like, right.
And we didn't. Again, our regular medicine, we actually didn't need to.
No.
Memorize.
Right.
I never had to go back to the Krebs cycle ever
No.
in my orthopedic practice.
Right.
But now it's at the root of everything we do, right?
Right.
So I think it's complex, and you and I have spent a lot of time studying and learning that so that we could figure out what goes wrong and intervene. And it comes down to everything you do where you're dealing with some very complex disease patients, right?
Yeah.
With Lyme and mold and these really complex diseases, but that still comes down to something went wrong at the cell.
Right.
Particularly, the mitochondria lots of times,
Often, yes. Then aging too, right?
Yeah.
So then aging can be seen as a disease even before it's become a disease.
the
Because
same thing's
again,
happening.
it's dysfunction of one or all of these pathways, usually mitochondrial is one of the things to start with. And then we're able to handle aging preemptively.
Yeah.
Let's say dementia, for instance, is really an illness that starts earlier.
It's a loss of some
Right.
cellular function.
That's exactly right.
If we were to look at all the things, take an example of dementia, and people are like, okay, well, it's nutritional, it's this, it's this. All those things still feed back into that, those nutritional deficiencies contributed to just a loss of function, at the cellular level, and ultimately oftentimes at the mitochondrial level. Once we lose energy, we lose the ability to do everything.
Exactly.
And that's where, before we had, and you can do a lot with medicines, drugs, supplements, hormones, but it really was where, until we had some peptides to go in there and
Yeah.
say, okay, listen, I can't repair your mitochondria without doing anything else but throwing some peptides into the mix. You can't just know peptides, right?
Right. 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 No, I mean, that's the point, right? Is that you can memorize how to use a drug, but that's not the same as understanding where the pathway went wrong and then why a certain peptide would be such a great key, for that, because it signals that pathway.
Right.
I think that's also what makes it so much fun.
Yeah.
And also we don't have to wait for scientists to figure things out, right? When new illness comes along, let's say COVID or something, we're like in real time figuring out what pathways are affected.
Yeah, we can go
and
back
then
to
we're
same
like,
things.
oh, you know what? We know something that intervenes right there. Or research what kind of drugs that we could repurpose.
Right.
Something hadn't been used for 10 years, that had already been tested by the FDA and was safe and something like that. And everyone else will have to wait for scientists to research that, do some sort of, study, and then bring it to the public. And we're like in real time going, oh, we already know something's safe to use for that. It's better than using even just your clinical judgment, right? It's better than using what someone else has tried because you already know.
Yeah.
It's going to focus right there.
Yeah. As the future goes on with the development of AI, with this knowledge, if you have these knowledge of pathways and you have knowledge of what pathways affected, now we can actually use AI to say, okay, this person has this dysfunction at this place in this pathway.
Yeah.
What's out there that I can utilize here?
Right.
So actually AI can be really helpful here to say, oh, well, that's a great place to pull this in. And it's usually a combination of things. It's just not one factor, right? It's not one thing.
And I mean, you can't use AI that way if you don't understand. Right? If you don't understand that, then you have to use AI to say, like, my gut's leaky. This patient's gut is leaky. What can I do about that? Instead of like knowing exactly what's happening,
One of the keys is that you and I are, kind of made the promise to ourselves and to our patients that we will keep learning because this is, new pathways get found literally every other month and new technology keeps developing. And unless you stay on top of it and keep learning, so we spend so much time and energy to try and keep learning and staying abreast of these things. And I think that's our commitment to our patients that a lot of people don't have. You have to be forward thinking, you have to keep learning and, and keep doing this stuff. And I think this is where you and I have so much fun lots of times just even talking about this stuff because we can really move forward. So thank you for being my friend and my colleague and my ally and helping me with tough cases and working together on these things. Let's continue to kind of fight for our patients. I think that's what it's all about.
It's an honor, and the feeling is so mutual. Thanks, Betsy.